Hey guys, Dr. Rob here, and I wanted to welcome you down to my health corner where today we are going to discuss a very important topic on how to address autoimmune disease, the root causes, what you can do to effectively help yourself. If you have Hashimoto's, Graves' disease, rheumatoid arthritis, lupus, scleroderma, sarcoidosis, you name it, most autoimmune conditions want to listen to this information today. And while you're listening, if you find you're getting valuable info, please take a moment, hit that like button, and if you want to hang out with me more, definitely hit that subscribe button as well as that notification bell. All right, guys, so let's get into the information today. Now, I did bring in the old school whiteboard because today's info is just so cool. This is what really occurs in almost all autoimmune disease that they don't tell you. No one tells you this. Your doctor has never told you this. I promise you, your rheumatologist, your endocrinologist, your autoimmune specialist has not told you this, but this is the mechanism at play for the majority of all autoimmune disease, for the majority. So what happens is you have a cell. For this example, we're going to pretend it's the thyroid cell, but it could be a joint cell, a skin cell, a hair cell, hair follicle cell. It could be any cell in the body, brain cell. We're going to pretend it's a thyroid cell. So the thyroid cell becomes invaded by a virus. So there's a virus inside the thyroid cell, or a toxin, or a heavy metal, or some other pathogen is in the area. A parasite, yeast, fungus, mold, there's something, bacteria, right? So this is sitting here in the cell. So let's say we have a toxin in the cell. The toxin creates damage in the cell. So it actually damages the cell. When the cell becomes damaged, we start to get inflammation in the cell or around the cell, and the cell starts to yell for help. The way the cell yells for help is it produces a group of chemicals or substances called cytokines. Now, cytokines, you may have heard of these. These are things like interleukin-1, interleukin-6, tumor necrosis factor alpha. There was discussion about these with COVID because the COVID virus does a similar mechanism in the body. It causes an elevation of these cytokines. COVID virus gets into the cell, damages the cell. We then get inflammation, and then the cytokine levels go up. So, to back up again, we have a virus, toxin, heavy metal, something inside the cell. That creates inflammation in the cell. The cell yells for help. It says, help. It does that by releasing the cytokines. So the cytokines now are in this area out here. It's called the extracellular space. It's the area outside of the actual cell. Now the cytokines are floating around. You'll get a white blood cell that comes just strolling on by, and the white blood cell goes, oh my God, this cell needs help. Whoa. Let's go ahead and let's help it. It's like, I'll help you, cell. And then it goes ahead and it alerts the entire immune system. Now we bring in the entire immune system, and the entire immune system goes, oh my God, the thyroid is in hell. It needs help. The thyroid is in trouble. And it actually comes over here and starts to attack the thyroid because it thinks the thyroid is problematic. But in truth, the thyroid is not problematic. There's no problem with the thyroid. There's a problem with something inside the thyroid cell. That's where the issue is, right? So people will go ahead and go, oh, it's an autoimmune disease. We don't know why it's happening. We don't know why the immune system is attacking the thyroid cell. Yes, you do. You definitely do. Well, in truth, your doctors probably don't. But in truth, there is something in the cell. There is something in the thyroid that's damaging and inflaming this thyroid cell, causing it to release these cytokines, causing then the white blood cells to go, oh my God, I hear your message, your cry for help. They alert the whole immune system. The immune system then comes back, and now it attacks the thyroid. Why is it attacking the thyroid? Because it's trying to get rid of all these toxins and junk like that in the thyroid cell. The problem is when it's attacking this stuff inside the cell also becomes damaged. So this is one of the basic mechanisms for autoimmune disease. The question your doctor never asks is he never says, well, why is your immune system attacking the thyroid? What your doctor does is go, what can we do to control these cytokines? What can we do to control this inflammation? And the immunological, the biological medications, they work here in this area. They try to calm this cytokine response. They try to calm the immunological response. That's what they're doing. Other drugs that are utilized for autoimmune disease, that's exactly what they're doing. They're trying to calm this autoimmune response. But we have to understand, wherever these toxins are, that's the name of your disease. So for example, if these toxins are in your thyroid cell, well, then it's Graves' disease or it's Hashimoto's. If these toxins are in your joint cells, it may be rheumatoid arthritis, or it may be psoriatic arthritis. It depends where the toxins are, but the mechanism is virtually the same. And this is one of the basic mechanisms. So medications work here. Now, supplements also work here. So one of the things people do is they'll use things like this. They'll use things like turmeric root. So turmeric root is absolutely wonderful. But where is turmeric root actually working? Well, this piece of root right here, this guy right here, this turmeric, it's working here at the level of the cytokines. It's calming the cytokine reaction. We could take it in root form. We could take it here in powder form. And essentially, we're sprinkling the powder right on the cytokines, and we're calming this whole reaction. We could use things like fermented vegetables or probiotics, right? So these are live, raw probiotics. This is a live sauerkraut, and this is a kimchi, right? So both of these are live, raw probiotics in here. And in some cases, these will calm the cytokine response. In other cases, we use things like black seed oil to calm the cytokine response. So this is black cumin seed oil specifically. Great cytokine calmer. We can also use things like olive oil. This is Little Gypsy Farms. I don't get any financial kickbacks from them, although they did give me a case of free olive oil once. I'll take another one anytime, Gypsy Farms. But these guys have a high polyphenol olive oil, tons of antioxidants in it, and this may help to reduce that inflammatory reaction that's connected with an elevated cytokine. We can use green tea. We could use the supplement resveratrol. We can use all these different supplements, right? We can use rosemary can help to calm that response. We can use parsley to help calm that response. We could use fish oils. People use fish oils when they have inflammation in their joints, right? All these things are anti-inflammatory. Green tea, all wonderful, all anti-inflammatory. Saffron, amazing. But where is all that working? It's working here. It's working here to calm this cytokine response. That's where it's working. So this is the issue. This is the thing that needs to be addressed right here. This is why detoxification is so essential. This is why it's necessary to do the right functional or bioenergetic testing. Because if you're doing the right functional or bioenergetic testing, you're able to find these root causes and you can deal with the pathogen, the bacteria, parasite, virus, mold, fungi. You could deal with the heavy metal or the toxin. You can deal with that because this is the root cause right here. Calming the inflammatory response with autoimmune medication or with nutritional supplementation is good. It's a good thing to do. It should be done. It's great. But, and I'm not claiming, by the way, that any supplements treat, cure, or prevent autoimmune disease, right? This is educational information. Of course, run this by your doctor. But regardless, when we look at this, whether it's a medication or whether it is a nutritional supplement working here to calm this, we still have the root. The root is still here. The problem is not the immune system. The problem is not the white blood cells. It's not the cytokines. The problem is here in the cell. We have to identify what that root is. And then once we identify it, we have to detoxify it. This is why I do these free webinars for you guys, right? Like how to detox your thyroid, how to detox for autoimmune disease, how to detox your adrenals, your liver, your lymphatic system, your kidneys. That's why I put on these free webinars for you guys to give you the tools to be able to detoxify your cells, to support your body's ability to heal itself, lower the cytokine response, and then hopefully allow your body to heal itself from autoimmune disease, right? So that's kind of the goal here. We could use those things that I just mentioned, turmeric, ginger, rosemary, parsley. They all work here to calm this reaction, which is great. But again, we got to get to the root. We got to get to that root. So ultimately, this is one of the main reasons why people have their autoimmune diseases. And all these different nutritional supplements and or foods and or lifestyle changes, they can help, right? Like sauna, for example. Being in a sauna can help release heat shock proteins, which reduce inflammatory cytokines. Doing cold baths can release cold shock proteins, right? Which, again, reduce cytokines. But will they kill a virus? Will they remove a heavy metal from a cell? Will they destroy a pathogen that's attacking or invading a cell? No. So doing these things like sauna 2 or 3 times a week for 30 minutes a time, or doing cold plunges for 2 minutes a time, 3 times or 4 times a week might be great things to do to help manage cytokine expression. But understand, we got to go deeper. We got to go deeper here into the cell. So that's one of the ways that autoimmune disease develops. Those are some nutritional things and some lifestyle things you could do to manage the cytokine reaction. Ultimately, you got to get with someone that understands bioenergetic testing and or functional testing to identify that root cause. And then once it's identified, they know what to do to help you, or you need to research and investigate that yourself, which is why I have this channel, so you guys can learn more and more about this. So I hope you liked this information today. If you did, please give me the thumbs up, hit the subscribe, hit the ding notification bell. And also too, check out below in the comment section, as I have some great free information for you. I'm actually running a free webinar right now that you could attend. There's no charge for this at all. So please feel free to sign yourself up for that. And also, if you're looking for other great information about health, you might want to check out this video right